Hello everyone, good afternoon. This is Miss Henderson and today I'm coming to you with a simple video on medication calculations. So as always, if you like this video, please give it a thumbs up and please subscribe to my channel. Thank you. So the student learning outcomes or the student learning objectives are the goals that are set for this chapter. Upon completion of today's lesson, the students will be able to demonstrate the following competencies. Discuss indication for intravenous medications. Demonstrate effective use of dimensional analysis to solve IV flow rates. Demonstrate the ability to calculate milliliters per hour, calculate IV flow rate of medication units per kilogram weight-based heparin. Use the formula method to calculate medication dosage. Integrate critical thinking skills to solve problems. Calculate IV flow rates in milliliters per hour using the formula method. Ability to integrate nursing considerations when administering medications and clinical judgment to enhance patient safety. So our second slide talks about the indication for heparin injections. So we know heparin, it's an anticoagulant, and it's giving some of the reasons why patient gets heparin. Some patients like with pulmonary embolism, patients with acute arterial occlusions will be candidates for heparin. Orthopedic surgeries such as patients had a hip replacement or patients that are had a knee replacement might be candidates for heparin injections prophylactically. Patients with acute myocardial infarctions might be candidates for heparin. So I have contraindications for heparin injections are patients with history of thrombocytopenia or patients with acute bleeding. You cannot give heparin to those patients. So we have a simple NCLEX style question here. And I'm going to read it for you. What signs and symptoms should the nurse monitor for patients who is receiving heparin 5,000 units subcutaneously daily prophylactic for right knee replacement? Select all that applies. So as we know, patients that are receiving anticoagulants are at risk for bleeding. Also easy bruising. Also can be a cold in stool. They could be bleeding through the stool, so you have to monitor that. Hemoptysis is coughing up blood, also might be as signs and symptoms that they're bleeding. So the correct answer is all of the above. So calculating intravenous flow rates, intravenous fluid is administered directly into the bloodstream for hydration purposes or hypovolemic shock. So if patients are dehydrated and they come in for dehydration or they're bleeding from a wound, they might be candidates for intravenous fluids. So I have a simple infusion calculation here, and in this particular problem, we are looking for drops per minute. So the physician has ordered Hispan 500 milliliters to be infused in 3 hours. The drop factor is 15 drops per ml. How many drops per minute should be administered to infuse the total amount of Hispan in 3 hours? So using dimensional analysis, as you can see, we're looking for X drops per minute. So the IV tubing that was giving to us 15 drops per ml. The volume of Hispan that was given to us is V is equal to 500 milliliters. And the time that was given to us is 3 hours. So we have to set up the equation in such a way that we can solve. So we have here milliliters and milliliters canceling out. Now we know, since we're looking for minutes, we were giving hours. So we have to convert hours into minutes. So we know that 1 hour is equal to 60 minutes. So now we can use dimensional analysis, cross out hours and hours, and we'll leave with minutes. So if you multiplied 15 multiplied by 500 will give you 7,500. And then you have 60 times 3, that will give you 180. So if you divide that in, you divide 7,500 to 180, your drops per minute will be 41.66. So because 6 is greater than anything that is greater than 5, you round it up to the next whole number. So you can program your IV pumps. So we'll round this up to 42 drops per minute. Let's look. So sample math problem. So we know that you always set up what you're looking, the formula method. It's total volume to be infused times your drop factor, total amount of time in minutes. So that's the basic formula for calculating flow rates. Let's look at the different intramuscular sites that medications can be given. The deltoid is our upper arm. We know that's a common site that medication can be given intramuscularly. We have the ventrogluteal site. The vastus lateralis is also another site, and the dorsolateral lateralis is another site that medications can be injected. So the most common site in children is the vastus lateralis. We have another problem here using dimensional analysis. A patient has an order for regular insulin IV at 5 units per hour. The concentration is insulin 100 units per 100 ml, 0.9 in 0.9 normal saline. At what rate in ml per hour should the IV pump be programmed for? So again, we're looking here for flow rates. We're looking for mLs per hour. So we set up our equation using dimension analysis, looking for XML. So 100 mLs was given to us, and that is infusing in 100 units. And we also have 5 units per hour. So we have 5 units in 1 hour. So units and units canceled out, 100 and 100 cancel out, and we'll leave with 5 mLs per hour. And that's the answer. Simple as that. So we have an NCLEX style question here. What lab test should be monitored for a patient on heparin subcutaneously daily, secondary to status post hip fracture? As I previously said, that patients that had knee replacements or hip fractures, they commonly get, it could be either Coumadin, heparin, Lovenox. They get these medications prophylactically in order to prevent or to reduce the incidence of developing deep vein thrombosis. So the lab test that needs to be monitored is PT and partial thromboplastin time. B is the answer. So I have a few questions here, medication calculations as a worksheet, so you can try to solve these problems. They're not difficult. You know, you could set up dimensional analysis and try to work on that worksheet. Parenteral medication. This is another simple one we have here. The physician has ordered alprazolam, 30 milligrams intramuscularly. The medication is available in 20 milligrams per ml. How much milliliters will the nurse administer? So how much will you pull up? Solve this problem using dimensional analysis. We're looking for XML. So in 1 ml is equal to 20 milligrams, right? And the medication order is 30 milligrams. So we have milligrams and milligrams canceling out. We have 30 into 20 is 1.5 mLs. And that's the answer. That's what the nurse is going to pull up in the syringe to administer to her patient intramuscularly. We have another simple equation, dimensional analysis problem here. The physician has ordered Cantor 400 milligram every 12 hours for pain. The medication is available as 0.5 grams per 2 ml. How many milliliters will the nurse administer? So you have to convert grams to kilograms first, right? So we know in 1 gram is equal to 1,000 milligrams. You just have to know that, memorize the conversion table, and we're looking for XML. So we have 2 ml in 500. So we have 0.5 grams is equal to 500 milligrams, and the doctor's order is 400 milligrams. So milligrams and milligrams canceling out. 4 times 2 is 800 divided by 500. Divide by 500 is 1.6 ml. So the nurse will administer 1.6 ml of Cantor for pain. Calculating IV flow rate. So we know the basic formula for calculating IV flow rate is volume in mLs divided by time, which is hour. So let's say a physician has ordered 1.5 liters of lactated Ringer solution to be administered over the next 12 hours. Calculate IV flow rate in mLs per hour. So we know we have to convert 1.5 liters into milliliters because we're looking for XMLs. So in 1 liter is equal to 1,000 milliliters. So therefore, 1.5 liters is equivalent to 1,500 mLs. And that is to be infused in 12 hours. So 1,500 divided by 12 is equal to 125 milliliters per hour. So that is what the nurse is going to program the IV pump to administer 125 mLs per hour. This is another sample problem we have here. You can work this out using the formula method or the IV flow rate method I provided. Dimensional analysis. The physician has ordered Amikin 150 milligrams IMQ 8 hours. Amikin's 500 milligrams per 2 ml is available. How much milliliters will the nurse administer? Again, we're looking for XML, so 150 milligrams and 500 milligrams per 2 ml. So milligrams and milligrams canceling out. 150 times 2 is 300 divided by 500. So the answer will be 0.6 ml of Amikins. The nurse will actually pull up in the syringe to administer to her patient.